So start it. Got it. Hi, good afternoon and welcome everyone. Thank you for joining us today. I'm Samantha and I'm the Director of Partner Services for the Florida Association of ACOs. We are excited for this opportunity to present to you with our next installment of our webinar series, a partnership to strengthen your value-based care strategy. Before we get started, I'd like to go over a few items so you know how to participate in today's event. You will see a user control panel at the bottom of your screen. You can listen in via your computer speakers, or if you would prefer to join in over the phone, just select telephone in the audio pane. You will have the opportunity to submit text questions to today's presenters by typing your questions into our questions tab. You may send in your questions at any time during this presentation. We will collect these and address them during the Q&A session at the end of today's presentation. With that, I'm going to turn the presentation over to Brian. Thank you so much for being here today.
Absolutely, Samantha. Thank you. And thank you for the invite to be here with you and for your members. This is a wonderful opportunity that we cherish, and we're grateful for the partnership that has already been established with the Florida Association of ACOs. You've done a great job and continue to do so. So I just wanted to say thank you for the opportunity to say a few things today. I'll go ahead and get started. And let's make sure you can see everything here. Hopefully you can see that screen all right.
You're good.
Okay, great. Thank you. Well, today, let's talk a little bit about developing a long-term partnership and how we can help drive two important areas to the practices that we're involved with throughout the country. Our model actually helps us to deliver services and products to allow the practice and the providers to provide improved patient care and also to drive new income to the practice. That's an important area of the foundational structure and the model of our business. Our business or our company is called Rx2Live. We actually have representatives throughout the entire country. Been in business now for several years, and I have personally been involved in the healthcare industry and the market for a little over 20 years. Had an amazing opportunity early on in my career to work with a group of people that were passionate about driving new income streams to local physicians and their practices and local hospitals. And I've generated a little over $1.3 billion in revenue for those partnerships that we put together in healthcare. So very passionate about this topic. Very excited to speak with you today. So we'll go ahead and get started. Again, my name is Brian Hazelgren. I'm the CEO of Rx2Live. We also have some of our wonderful partners on the call today and on the webinar today. Ramey Packard is up in Jacksonville, Florida. John Fogarty is in Orlando. Tom and Mary Dort, they are also in Tampa, St. Pete area. I actually live in Phoenix, so I travel around the country and headquartered out here in the sort of the Southwest. So I can appreciate the heat that Floridians encounter each and every day in the summer. We just don't have the humidity. So that's why I'm not wearing my jacket. It's too hot. Anyway, that's your team, and I'll bring that up on the screen later again as we wrap up so you can have some contact information. Let's talk about some of the challenges that our physicians and our providers face. We all know that providers want to focus on their patients' needs. That is a given. That's why they're doing what they do. And we're so grateful for them. As a patient, I'm so thankful for my physicians and medical professionals that I work with. But sometimes those providers get overwhelmed with administrative duties. Another challenge is practices need additional services sometimes to stay competitive and provide or improve on patient care. The providers and the staff are overwhelmed and patients feel the negative environment. Again, I've been in medicine now for 20 years, and I have seen, we've all lived through the pandemic, but what we see is that sometimes the staff does get overwhelmed. My wife is a medical assistant. I hear the stories each and every day. At the end of the day, I've got a son who's an anesthesiologist. I've got a son-in-law who is an MD. All of our family is pretty much involved in the medical or dental space. So we understand that. But as a patient now, if I switch gears here, as a patient, if I walk into a negative atmosphere, I can feel it. I know it. And I know when the staff's overwhelmed. So those are some challenges we want to kind of unpack today. Physicians don't like spending time on the administrative side of running the business. Providers feel like they get taken advantage of when it comes to purchasing equipment and supplies. I've heard that so many times over the last couple of decades. I want to talk to you about a solution with that as well. This is an interesting statistic I'd really like you to be aware of. The average American small business, and this includes practices, medical practices, will lose 23 to 30% of its customers each year due to a lack of customer or patient loyalty. That's a huge number. That's a big time number. And we've got to fix that. Well, we've got some ideas for you that we'd like to share on how to work on fixing that challenge that we have as well. Providers are also have told us many times over that marketing and advertising is an absolute mystery to them and that they need more business training. Again, we've got a solution and an opportunity to help meet that challenge or those challenges that the practices face each and every day. So I believe very strongly that providers should be looking for new streams of income. It's a competitive environment. There's so many revenue streams that have been cut back or even taken away. We need to start looking at new streams of income at the practice level. This will help to keep the practice competitive. And then later on down the road, sometimes the provider may look at retiring. Well, let's retire well, and let's create a higher valuation. Some of those additional ancillary services and products will be able to help you to accomplish that. Our opportunity that we see is driving new income can build a higher valuation in that practice, but then we have to ask ourselves, what tools or what services can we deliver? We'll talk about that today as well. So I think you should be, as a provider, that we always should be looking for services that do not disrupt the patient flow. That's critical. And that's the type of environment that we have been involved in for many years and understand that from a business point of view. I'd like to share with you some of those ideas as well. We know that, again, staff members, our physicians are experiencing burnout. Let's just talk reality here for a moment. But we also know that there's a solution to that, and that's helping to build and then maintain a positive culture. Got some ideas for you to share as we get into the presentation on that as well. And then keeping in touch with your patients is crucial, I believe. But what tools are there available? We'd like to show you what that might be and even help you, whether it's us or another outside firm. It's always good to have another set of eyes looking at the practice and from a different point of view where you're not so close to it. Schedule some time with a professional to come in and just give you a free analysis of what those additional services and products may look like on a hypothetical example. We can run that for you and talk to you about that, or another firm. Just make sure you do that is the point. Schedule a practice analysis with professionals who are in the business world to help you analyze how things are going in your practice from a business point of view. So let's talk a little bit about some of the services and the products that we deliver to our practices and our providers across the country. We have what we call a combination of the triple play, kind of an old baseball analogy, but we combine chronic care management, remote patient monitoring, medication management. A little bit later, I'm going to talk to you more specifically about remote patient monitoring and why that's so key and why that's so important. We also have behavioral health screenings that are very important to help test and check the mental awareness and the mental health of your patients. Because I've been involved in medicine now for so long, and from a business perspective, I created a system called the MBA for Doctors. Now, I used to teach MBA students. I actually created the Entrepreneurship Center with 3 other entrepreneurs several years ago at the University of Utah. We ran that for 10 years. We launched, trained over 3,500 MBA students. We launched over 1,100 companies. I was speaking at a conference a couple of years back, and someone asked if they could license those materials. And I said, no, why don't we just rewrite it and make it specific to the practice level? Because running a practice is completely different than running a restaurant or building another services business or a manufacturing company. So MBA actually in this particular title stands for Masters of Business Acceleration. A little bit of play on words, but we have training available for our providers, for our physicians. It's online training that you can go at your own pace, or you can attend one of our workshops at different parts of the country, have a fun weekend together. We actually have 2 of those training sessions. One is called the MBA for Doctors, and the other one is Highly Successful Marketing Strategies for Physicians. Another online course, and also available in webinars and in person. We didn't forget the staff, because Chapter 9 of MBA for Doctors literally focuses on building and maintaining that positive culture and that environment within a practice. We call that the Mastering Positive Thinking program. It's in a complete separate training system. It's available for the practices, for the staff. It also is an online learning system. And we also do webinars to help the staff find that level of balance in their life, because they're so overwhelmed and so stressed. We also have a newsletter. We send out the newsletter for and in behalf of the practice. We actually market so that it's at the top, so that your patients know that it's coming directly from you, the provider, but we write it for you. It's a 4-page newsletter. It talks about health and wellness initiatives, of course, but it's called the Positive Times. It's a fun little newsletter to give great stories about the importance of creating that positive environment at your home, at your work, with your friends, with your loved ones, wherever it may be. And you also have a full page of advertising that you can put on there, or write an article yourself, but we send it for you. Nice little way to keep in touch with your patient base. We have other health and wellness products like a weight loss system, a DNA test kit to check the blueprints of the genomics of the patient. We have other products that'll for heart health. And then, oops, sorry, I'm hitting the wrong button. And then we also have a heart screening program that, when we come to that point of the presentation, I'll turn that over to Ramey Packard. She'll give you a quick overview of that. It's a beautiful system to check the heart health. And I love that. We went through that myself and learned some good things about my own heart. So let me chat with you just for a moment about, in the triple play, let's talk about remote patient monitoring. Remote patient monitoring, as you know, has, or maybe if you haven't implemented this already, you've heard about this, but it's basically digital technology that collects the medical information and other forms of health data that's transmitted back to the provider or to the caregiver. Of course, the patient has a record of that as well. It's also logged onto, it goes from the app. I'm wearing my device at the moment, and I can check everything on my phone, but it also gets uploaded to my provider. The cool thing about this remote patient monitoring is there's so many levels of reimbursement now that you need to be aware of. This is a great revenue income driver for the practice, but more importantly, it's a way for the patient and the provider to get a 24/7 view of vital signs like blood pressure or blood sugar levels, blood oxygen levels, your heart rate, sleeping patterns, stress levels, body temperature, and weight. This is a beautiful system. It's technology. In one of the chapters, chapter 14 of MBA for Doctors, I talked specifically about the need for technology and what the practice of the future will look like. Because of the pandemic, we created this platform. It's working beautifully throughout the country. We've got a lot of patients on this system, and the doctors love it. They love it because they can see a 24/7 view in the dashboard. It's a beautiful system you need to be aware of. Electronic behavioral health screenings. So we have those available. It's very simple. Make it really easy for the receptionist to just hand that directly to the patient as they walk through the door. As they're sitting in the waiting room or while they're in triage, they can take a screening. Some, as you know, like the PQH9 or some of the other ones that are shorter, Those are on the system, but there's 30 different screenings that are loaded onto the system. They provide immediate results while the patient is there, so the provider can chat with them about what those results look like, especially if there might be some red flags and maybe a referral needs to be provided. You can also choose what type of screenings you'd like your patients to take. You don't have to do all 30. You can focus on 3 if you'd like. That's all customized to you and to your patients, and you control that. It's really a non-invasive way of ensuring that patients have a good, safe level of their mental health. That's the whole point of the behavioral health screenings. Again, immediate results, or you can also have a nice way for the provider to have a conversation and create a billable event with the patient while they're right there. Very easy to put that program together. Next, again, we have the training system, which is MBA for doctors, and then a marketing program. Remember, one of those challenges that our doctors have told us over the years is that advertising and marketing is a total mystery to them. We have a training system on that specific thing, not just for marketing the practice out to the rest of the world, but what about if you bring on one of these new services or products, and it doesn't have to be ours, but if you do bring on a new service or a product, how do you tell your patients about it? We've got a whole system built for that as well, so you can get the word out and bring them into the office or do a telehealth visit. Whatever it may be, we've got some great ideas in that training system for you. The staff training, again, there are 10 modules in that particular program for the staff. And it doesn't just focus on, always being positive all the time. It literally has science behind the different chapters to explain why a positive attitude and a positive outlook on life is so critical to our overall health and wellness. It's literally a training system that you can take online, that you can do at your own pace. And it's a fun way to literally start building a positive culture within the practice. We've actually taken that system out to a lot of our corporate clients as well. So it started with the practices. It started in MBA for doctors with our providers and the staff of the practice, but it's now out to the rest of the world because it's universal. And it's something that's very important. The next one, again, is our newsletter. Again, that's a 4-page format. You control one of those pages on what message you'd like to send to your patients. The rest of it's it's a done for you newsletter. We write it for you. We send it out for you. It's an electronic newsletter that gets to your patients. We can also print that if you'd like. It's just a nice way for you to stay in touch and in contact with your patients. And they do appreciate that. It's very, very cost-effective, very inexpensive way of keeping your brand, keeping your practice, your name in front of your patients. For now, I'm going to pause, and hopefully Ramey Packard's on board with us now. I'll turn some time over to Ramey, and you can cover the heart screening program for us, Ramey.
Thank you, Brian. Thanks for taking some time with us today. We have noticed that there's staggering numbers of individuals with undiagnosed heart disease, and there's a high death rate caused by cardiac issues. And then we found that COVID has had a huge impact on individuals' hearts. So we're really excited to be able to introduce our heart health program today. The heart program is built on the foundation of performing a test using a machine called the multifunction cardiogram. It's fairly new to the market, but it's a diagnostic tool that provides rapid and accurate information. It's very objective, non-invasive, and very cost-effective. It only takes 10 minutes and can be done in a doctor's practice. Even though you may have not heard of this machine, the creators have been working on the technology since the late 1970s, so they've been working on it a long time. After decades of research, multiple high-quality peer-review published clinicians all around the world have actually brought this into their own practices. Independent investigators have continuously rated MCG as a high-ranking modality for discovering heart disease. Sometimes they even rank it 5 times more accurate than the traditional EKG and image testing. We've done our homework to ensure that the MCG works in real-world point-of-care settings, even on some of us ourselves. The device has been cleared by FDA of multiple nations and was chosen by Highmark Medicare as a replacement of the current stress imaging tests on the market. It's equally excellent for both men and women, and it detects the early detection and prevention of cardiovascular disease. The development team, their greatest priority has been ischemic burden measurement, but additional markers needed to be used to describe the heart within a functional and a physiological context. So this technology fills the knowledge gap left by empty and other diagnostic tools. It's able to deliver high levels of unprecedented diagnostic accuracy, ranging from 89% to as high as 100% accuracy for patients affected by heart diseases at all stages. Such diagnostic accuracy is surely needed to reduce death, heart attack, and stroke. The device is portable, and we actually have a mobile unit in Florida, and we can come and do testing at your facilities. Or if you wish to have a more permanent placement, we do have permanent placement options available. We're also the local sales, training, and support team for your practice or for the practitioners. Detection is just the first step. And then we recommend following this up with better understanding of whether the issues are genetic or environmental. We do that through various lab tests. And then as needed, the practitioner can help and assist with lifestyle changes. I am a perfect example of that. I had my first scan about a year and a half ago and realized that I was in need of some changes. If I didn't change, then I may not live past 65, was the results that I was getting back. So I made some changes and just had a test done yesterday, actually, and improved drastically. So we know that this is a great way to keep track of the patients as they're going through these changes. It can also be used for pre-op, and each program can be tailored specifically for the practice. So we don't have to do the same program in each practice. We can make it your own. So our mobile team is available to come and perform a demo test at your facility, and you can see how quick and easy the test is. It is compared to the other gold standards of care. When identified early, heart disease can usually be reversed. Most people don't even know that they have heart disease until it's too late. EKGs and stress tests have been proven unreliable for measuring heart disease. Some are as low as 15 to 30% accuracy. Even if a previous clean bill of health has been given, there is still maybe hidden heart disease. 1 in 4 people that you know will die from causes related to heart disease, and for most, it will be their first symptom. Now you will be able to have access to this tool that can help change that. This is just a quick overview of the MCG testing device, but there was an article written not too long ago by the developer and creator of this device, and it was in the Orlando Medical News. And you can go there and look in the archives for the December 11th issue of 2020 and get a lot of technical information. But we'd be happy to come and share this device with you and test even your staff and yourself. So I'll turn the time back over to Brian and we'll go from there.
Wonderful. Thank you, Ramey. Appreciate you doing that overview. Very informative, and it's a very good program. So that kind of wraps up what we have for our products and services area. As you've seen, we have a lot of things to offer. Love to chat with you about any of those particular products and services, and also like to show you some of the system that you tap into when you work with our amazing people like Ramey and John and Tom that are on the call with us today. They're all out in the Florida market. You know, you receive products and services. You basically have a menu of options for the products and services. We have ongoing webinars. We have workshops that are in person. Now that things have been relaxed a little bit, we can meet in person and enjoy each other's company, but also be live. We have provider training and staff training. We're even doing events in local markets now that we're able to do that. We've got a few scheduled for the rest of this year where we're actually doing 2-day events and having keynote speakers and great presentations from different vendor partners, as well as having some of our physicians presenting. And also breakout sessions. So very good that we're able to start doing those again. We have an experienced team, not just out in the field, but also back at the corporate offices. We have a lot of marketing ideas to help you market to your patients. And if you'd be interested in a practice analysis, it's free. I would take advantage of it if I were you, because it's very simple and easy to do. It just takes a few minutes, but gives you some other ideas of maybe where you can grow your practice and improve some of the patient care. So we have some testimonials I wanted to share with you before we wrap up. One of those is from Dr. Berger. He said the combined services that you offer is allowing us to save lives and generate additional revenue into our system. And that is a solution that's hard to find these days. Dr. Mark Olson, we are very excited about the training system to help us build a better, more productive, positive culture. The positive newsletter that you guys send to our patients is awesome, and this is definitely a great investment. Dr. Davis, screenings have increased our revenues through insurance reimbursements, and they help us to avoid penalties by closing care gaps through MIPS. We routinely get 80% plus of our claims reimbursed, and the reporting process is very easy. I'm very happy with the program and with the support Rx2Live gives us. Dr. Lamarca, CCM and RPM, remote patient monitoring, coupled with medication management is saving lives. Physicians should discuss this option with their patients as soon as possible and get them enrolled into the program. Dr. Berg, using your wearable technology for RPM is a tremendous model for improved patient outcomes and to our bottom line. So we're grateful that they sent us those. We've also got video testimonials if you'd like to see some of those as well. So to kind of wrap up here, we've got a member model that drives value. Our goal here is to be a trusted and services provider and partner with the Florida Association of ACOs. That's our goal, and to work directly with the members of the association so that we deliver the services and products that'll help you build your practice, but really choose what fits your practice. Some of those member privileges that we haven't really gone over in this presentation, we'd love to chat with you about it, but there's certain special offers because you're a member and discounts that are only provided to the members. That physician event that I mentioned earlier, if you'd like to look at that down the road, we are doing those now, and they're wonderful events, 2-day events with speakers and breakout sessions, even a little mini trade show. So we could look at putting something on like that in the future as well and provide a lot of value to the members of the association. So what do you need? If you'd like to do a free practice analysis, you can look at some hypothetical examples. If you were to implement a certain service or product, what does that look like to the practice? What is the bottom line? How does it help you grow? How does it help you provide improved patient care? We can provide all that for you, and it doesn't cost you anything. It costs a few minutes of your time, your valuable time, but it will definitely be worth it. We also have these devices available with remote patient monitoring. So we're telling you, you don't have to pay for the device. Your patient doesn't have to pay for the device. We've worked out a scenario with the manufacturer that, when there's services offered and you use our entire system, it's based on a subscription model. No one has to pay for that device up front. We've got 50,000 of those devices on the shelf at all times. We can get those out to you. We can get some devices to you where it's not going to cost you anything, and you can try it out and see how your patients work with it, and if they like it, and if you like it. It's a nice little program to get more patients onto the remote patient monitoring platform, but also help them to improve their health and well-being, their overall well-being. If you'd like to, as Ramey mentioned, if you'd like to see a free demo of the heart screening system that we have, more than happy to provide that for you and your staff, even test it out on some of your patients. We have the remote patient monitoring solution again. And then if you'd like to get a link to test drive some of the online training, we'll share that with you as well. For now, just wanted to wrap up and let you know that we have a team in the Florida market. We have Ramey that you just heard from, Ramey Packard. In the Jacksonville market, you have Tom and Mary Dort, who are also in the Florida market in Tampa, St. Pete area. John Fogarty is in the area of Orlando. We also have other representatives down south in the Miami-Dade, Fort Lauderdale area. So we've got the state covered. We've got people who are available to answer your questions. And we've got a system that's been designed specifically to help you grow your practice in several different ways. And again, our goal is to almost be like a restaurant. When you walk into a restaurant, you don't always order the same thing, but you do look at a menu of options that you have in front of you. Sometimes it might be very simple where you have, just a few options, or it can be very elaborate with some of our restaurants that have over 250 items in their menu. But we want to make sure that we deliver on those services and products that you choose specifically for your patients that you're comfortable with. And even if we have some bundled offers, you can even unbundle those and just offer one of the 3 services if you'd like to. Point is, our goal is to assist our physician partners by driving new income streams to the practice, but also help you improve your patient care and provide better outcomes for your patients. So I'll wrap up for now. And again, tell you all, thank you for spending a few minutes with us today. It's indeed an honor and a privilege to talk to you all and present to you and let you know a little bit about Rx2Live and the partnership that we have with the Florida Association of ACOs. So for now, I'll wrap up and I'll toss it back over to Samantha.
All right, thank you so much, Brian. I did have a couple of questions that came through. How many patients does Rx2Live network currently serve?
Well, that's a question that is actually throughout the entire country through several different vendor partners. There's probably over 35,000 different patients in our system when you include our vendor partners.
Okay, and then the last one I have for today is, as some of the ACOs cross into other states, can Rx2Live support them seamlessly?
Yes, we have representatives throughout the entire country, all but just a couple of states. Down in your neck of the woods, we have representatives all covered in the Southeast.
Okay. Awesome. Well, that's all I had today for questions. Thank you, Brian. Thank you, Ramey, Tom, and John for being on the call today as well. We appreciate your partnership and so happy to have you guys join us. Just so everyone knows too, they will be an exhibitor at our conference coming up in November. So as a reminder, please, get registered to attend the November 4th and 5th conference here in Orlando. And if you have any questions, feel free to reach out to me directly, or you can go to our website at www.flacos.com. Thank you again for your participation. And if you have any questions, you can reach out to them directly, or you can reach out to me and I will put you in touch with one of them. I hope you all have a great day and take care.
Bye now.